Can we talk honestly about why health isn't always solely up to us? Before you roll your eyes and click away, please remember that while there are certainly some things we can control, there are other things we simply cannot. Many of us cannot control social determinants of health, yet significantly these social determinants of health impact our health outcomes. And as providers, we must understand the impact of social determinants of health when it comes to how it impacts our delivery of equitable care to our patients and clients. That's why by the end of this video, you'll understand how social determinants of health affect well-being and how to address these factors in your practice. Now, before we dive deep, let me properly introduce myself. My name is Tomesha Campbell, and I help healthcare providers identify and address implicit biases in their practice so that they can deliver equitable care. So whether you realize it or not, implicit biases, which refers to ingrained stereotypes or attitudes that unconsciously affect our judgments and behaviors, can exacerbate social determinants of health. Now, I keep using that phrase, so let me actually define it. Now, social determinants of health encompass socioeconomic status and environmental factors such as income, education, and neighborhood conditions, which can significantly influence an individual's health outcomes. In other words, a person's socioeconomic status can impact their access to healthcare, which plays a critical role in shaping their health outcomes. One of the things that we know from the research is that disparities in access disproportionately affect Black, Indigenous, and people of color. So whether it's lack of insurance coverage or transportation issues, we know that these are common barriers that impact the health outcomes of BIPOC folks. And due to these barriers, we also know this contributes to delayed diagnosis, unmanaged chronic conditions, and poor health outcomes. However, access is only one part of the equation. Healthcare quality is the other. Healthcare quality encompasses cultural competency, provider bias, and patient-centered care, which powerfully influence treatment outcomes. By cultural competency, I'm referring to a provider's ability to address the unique needs and preferences of the diverse populations they're working with. However, we cannot dismiss the impact of implicit biases, which can impact our clinical decision-making and patient-provider interactions. And finally, patient-centered care is crucial because it allows providers to focus on shared decision-making and empathy in their healthcare delivery. Therefore, it's essential for healthcare providers to recognize their role in addressing these factors to ensure equitable care for all their patients and clients. Now that we've covered how social determinants of health affect well-being, let's discuss the one thing you can do to address at least one of these factors in your practice. One simple yet impactful step healthcare providers can take to address healthcare access and quality in their practice is to prioritize cultural competency training. By fostering a deeper understanding of diverse patient backgrounds, beliefs, and values, healthcare providers can effectively tailor their care approaches to meet individual needs. This includes actively listening to your patients, providing language interpretation services when necessary, and creating a welcoming and inclusive environment in the clinic or hospital setting. Embracing cultural competency enhances communication and trust between providers and patients and plays a critical role in reducing disparities and improving health outcomes across diverse communities. So if you're ready to take action and deepen your understanding of diversity and inclusion in healthcare, I invite you to subscribe to my weekly Substack newsletter. In it, I dive deep into the issues that we only scratched the surface on in this video. Head to ebwhcommunity.com to sign up today. Thank you so much for joining me today. I look forward to continuing this journey with you. And remember, your actions as a healthcare provider can help shape a more equitable healthcare system. Subscribe and hit the notification bell to stay up to date on our latest videos. And together, we can enhance Black women's health and create a better future for us all. Enhance Black women's health. Subscribe now.